Welcome to today's video about what happens to your body when you apply castor oil before sleep. Between midnight and 400 a.m., your body runs a deep cleaning cycle. Your liver dumps toxins. Lymphatic vessels contract to clear cellular waste. Your metabolism shifts into repair mode. After age 40, this cleaning system slows down dramatically. Waste accumulates, joints stiffen. Bloating becomes your new normal. You wake up feeling like you aged overnight. For 15 years, researchers at Germany's Max Planck Institute studied an ancient oil that activates specific receptors controlling waste movement through your intestines and tissues. In 2012, they published their breakthrough in the Proceedings of the National Academy of Sciences. This oil contains a fatty acid that binds to prostagland and EP3 receptors, microscopic switches on smooth muscle cells. When activated at night, these receptors trigger contractions that help eliminate what has been building up all day. The oil is castor oil. Applied before bed, it works with your natural cleaning cycle in ways scientists can now measure and explain. I only share information backed by peer-reviewed medical studies. Today, you will see the exact research, not folktales, but biochemistry published in medical journals you can verify yourself. You will learn 7 specific benefits, the contamination problem affecting 90% of store-bought oils, and the simple protocol used in clinical trials. But first, if this is your first time here, welcome. We share evidence-based health strategies for people over 40 who want why detox slows after age 40 real solutions. Hit subscribe and the bell icon so you do not miss our upcoming videos. Drop your age in the comments and tell me your biggest health concern. We read every comment and create videos based on your questions. Castor oil comes from resinous communist seeds. About 90% of it is ricinoleic acid, a fatty acid found almost nowhere else in nature. In 2012, Dr. Stefan Offermans at the Max Planck Institute discovered exactly how it works. His team published findings showing ricinoleic acid activates prostaglandin EP3 receptors on smooth muscle cells in your intestines and tissues. Think of EP3 receptors like doorbell buttons on cells. When ricinoleic acid presses them, muscle cells contract gently, moving waste through your digestive system and helping lymphatic fluid flow. The researchers proved this using genetically modified mice lacking EP3 receptors. Those mice showed zero response to castor oil, confirming EP3 is the specific mechanism. This is documented molecular biology published in one of the world's most respected scientific journals. All right, let us break down the benefits of applying castor oil before sleep. Starting with benefit number 1, digestive relief and bloating. When you wake up with the Max Planck Institute Discovery flatter stomach after applying castor oil, here is what happened while you slept. Ricinoleic acid penetrated your abdominal skin and reached EP3 receptors on intestinal smooth muscle. These receptors triggered gentle contractions. The medical term is peristalsis, moving trapped gas and waste through your system. A 2011 study published in Complementary Therapies in Clinical Practice tested elderly patients in Turkish rest homes. 80% had suffered constipation for over 10 years. They applied castor oil packs for 3 consecutive days. The results showed decreased straining during bowel movements, improved stool consistency, and a greater feeling of complete evacuation. This was not about frequency. They did not have more bowel movements, but the movements they had became easier and more complete. The stuck waste finally moved out. When you apply a pack to your abdomen before bed, you give EP3 receptors 8 hours to work. The contractions happen slowly, gently, and naturally synchronized with your body's nighttime cleaning cycle. You are not forcing anything. You are supporting what your body already wants to do, but struggles with after 40. Next, benefit number 2, lymphatic system activation. Your lymphatic system runs parallel to your blood vessels. Unlike blood, which has your heart as a pump, lymph fluid has no pump. It depends entirely on muscle contractions to flow. This system collects waste from around every cell and transports it to elimination organs. EP3 receptors explain simply, when it slows with age, waste accumulates, you feel puffy, sluggish, and inflamed. In a double-blind study by Harvey Grady, published in the Journal of Naturopathic Medicine, 36 healthy adults received either castor oil packs or placebo packs. Blood tests showed significant increases in T11 lymphocyte counts within 24 hours for the castor oil group. T11 cells identify and attack viruses, bacteria, fungi, and cancer cells. A 2-hour application increased both total lymphocyte count and T11 cells, representing a measurable immune defense boost. When you apply castor oil over your liver or abdomen before bed, you may support lymphatic drainage during your body's deep cleaning hours. The gentle muscle contractions from EP3 activation may help lymph fluid move more efficiently. Your immune system gets reinforcements while you sleep. Next benefit number 3, joint pain reduction, knee pain, lower back stiffness, shoulder discomfort. These are not just part of aging. They are inflammation your body struggles to resolve. In 2009, Indian researchers published a clinical trial in phytotherapy research. They tested castor oil against the Clunac sodium, a powerful anti-inflammatory drug prescribed for arthritis. 100 patients with knee osteoarthritis were divided into 2 groups. Group 1 received castor oil capsules orally. Group 2 received diclofenac sodium. Both digestive relief and bloating reduction treatments were taken 3 times daily for 4 weeks. The results showed both produced significant pain reduction and improved joint function. But the castor oil group reported 0 adverse effects. The diclofenac group experienced multiple side effects, including digestive issues, headaches, and dizziness. The study concluded castor oil may be an effective therapy for knee osteoarthritis, with superior safety compared to conventional medication. When you massage castor oil into a painful joint at night and cover it, ricinoleic acid penetrates and may reduce inflammatory signals. The anti-inflammatory properties work while you sleep without the digestive damage. Oral anti-inflammatory drugs can cause many people report waking with reduced stiffness and improved range of motion. Next benefit number 4, scalp blood flow and hair support. Hair loss and gradual thinning after 40 have a specific biological cause. Researchers identified in 2012, Dr. George Cazarelis at the University of Pennsylvania analyzed scalp tissue from balding and non-balding areas. Published in Science Translational Medicine, the study discovered balding scalp contained 3 times more prostaglandin D2 than non-balding scalp. When PGD2 was applied to cultured hair follicles, hair growth stopped. They identified the GPR44 receptor that PGD2 uses to inhibit growth. This was a major breakthrough. Now, here is what we know about castor oil. While we lack studies proving rich in oleic acid blocks, PGD2 directly, topical application increases blood flow lymphatic system activation to the area. Better circulation means more nutrients and oxygen-reaching hair follicles. When you massage castor oil into your scalp before bed, you give follicles 8 hours of increased nutrient delivery. The fatty acids also coat and protect the hair shaft. People report improvements in eyebrow thickness, eyelash length, and regrowth along hairlines after consistent nighttime application over several months. This is not overnight magic. It is patient. Consistent support for struggling follicles. Next benefit number 5, skin hydration and barrier repair. Your skin barrier. The outermost layer is made of cells held together by lipids. When this barrier weakens, moisture escapes. Your skin looks tired, lined, and older than you feel. Most moisturizers sit on top of the skin. Castor oil works differently. It is both a HC-tant and an emollient, attracting moisture while also softening and penetrating the skin. Ricinoleic acid is small enough to move between skin cells into the upper dermis. There it helps repair the lipid matrix that holds skin cells together. When applied before bed, your skin has 8 hours to absorb these fatty acids. The oil fills microscopic gaps in your skin structure and supports ceramide production, the natural lipids your skin needs to retain moisture. Many people report waking with plumper, smoother, more hydrated skin. Fine lines appear softer because the skin is hydrated from within, not just coated on. Joint pain and inflammation support the surface. The key is quality and consistency. You need hexane-free cold rest oil stored in glass in regular application. Your skin does not transform from one use. After 2 weeks of nightly use, the difference becomes visible. Next benefit number 6, scar tissue softening. Scar tissue is disorganized collagen. When your body heals a wound, it prioritizes speed over aesthetics. The result is fibrous, raised, sometimes discolored tissue. Castor oil will not erase scars. Anyone promising that is lying, but consistent application over months can soften and fade them. Ricinoleic acid penetrates deep enough to reach fibrous tissue beneath the surface. It has mild anti-inflammatory properties that reduce irritation and tightness. Over time, the oil appears to encourage more organized tissue remodeling. This applies to surgical scars, stretch marks, and acne scars. The process is slow, 3 to 6 months of nightly application before visible improvement. But for people dealing with prominent scars affecting confidence, castor oil offers a low-cost, low-risk option before considering laser therapy or microneedling. The protocol is simple. Clean the scar. Apply castor oil. Massage gently for 2 to 3 minutes. Cover with a bandage if needed every night before bed. Patience is required, but the cost is minimal, and the risk is scalp circulation and hair health essentially zero for most people. Next benefit number 7, dry eye comfort. Dry eyes are not about water deficiency. They are about oil deficiency. Your tears have 3 layers: mucus, water, and oil. The oil layer prevents water from evaporating too quickly. With age, the tiny oil glands in your eyelids, called meibomian glands, become clogged or stop producing enough oil. Tears evaporate faster. Your eyes feel gritty, burning, and uncomfortable. Castor oil applied carefully to closed eyelids before bed may help. The lipids can stabilize your tear film and may help unclog meibomian glands. Many people report waking without the sandpaper feeling they had grown accustomed to. Some optometrists now recommend castor oil eye drops, specifically formulated for the eyes. Even topical application to the eyelids can help. The method is simple. After washing your face, place a tiny amount of hexane-free castor oil on your fingertip. Close your eyes and gently massage along the lash line and eyelids. Let it absorb overnight. Never put castor oil directly into your eye skin barrier repair and hydration unless it is a product specifically formulated for that purpose. Eyelids only. Now, a critical safety warning. Before you buy castor oil, you must know about the contamination problem. Castor seeds are extremely hard to press. Many manufacturers use hexane, a petroleum-based chemical solvent, to extract the oil. Hexane dissolves oil efficiently, then the mixture is heated to evaporate it. The problem is that hexane is a known neurotoxin. The Environmental Protection Agency classifies hexane as a hazardous air pollutant. Chronic exposure can cause peripheral neuropathy, leading to nerve damage in the hands and feet. Research published in the journal Foods confirms hexane is widely used in oil extraction, and residues can remain if not properly removed. When you apply hexane-contaminated oil to your skin nightly, you risk absorbing a neurotoxin. You think you are detoxifying, but you are actually contaminating yourself. The second problem is plastic. Ricinoleic acid is a powerful penetrator. It can leach BPA and phthalates from plastic bottles into the oil. These are dry eye comfort explained endocrine disruptors that mimic estrogen. There are non-negotiable requirements for safe castor oil. It must be hexane-free. It must say cold-pressed or expeller-pressed. It must be stored in a glass bottle, never plastic. Organic is strongly preferred to avoid pesticide residues. If the label does not state all of these clearly, do not buy it. Now, the practical application protocol used in clinical studies. For digestive and lymphatic support, apply 1 to 2 tablespoons of hexane-free castor oil to the abdomen. Cover with an old cloth because it stains permanently. Place a hot water bottle or heating pad on low. Leave it on for 30 to 60 minutes or wear it overnight under an old shirt. For joint pain, massage into the affected joint. Wrap with an old cloth and leave overnight. For skin, apply a thin layer to a clean face. Allow it to absorb for 20 minutes before bed. Use an old pillowcase initially. For the scalp, the castor oil contamination problem massage into the scalp and hairline. Cover with a shower cap. Sleep and wash it out in the morning. Do this 2 to 3 times per week. Start slowly. Some people experience a Herxheimer reaction, temporary symptoms like a mild headache as toxins are released. This usually passes within a day. If you have IBS, colitis, Crohn's disease, or if you are pregnant or nursing, consult your doctor before using castor oil topically. Conventional medicine treats symptoms. Pills for pain, laxatives for constipation, sleeping aids for insomnia, but these symptoms often share a common root: accumulated waste your body can no longer clear efficiently. You now know about an ancient oil validated by modern science, the EP3 receptor mechanism published in the Proceedings of the National Academy of Sciences. Lymphocy increases documented safe clinical application protocol in peer-reviewed journals. Knee pain reduction comparable to pharmaceutical drugs. Hair loss research from the University of Pennsylvania. This information exists in medical databases. I have given you the studies. Verify every claim tonight. If you choose to try this, use hexane-free cold rest castor oil stored in glass. Apply it before bed. Let your nighttime cleaning system receive the support it has been missing. If this helped you, tap like. Share it with someone over 40 who needs it. Type your biggest takeaway in the comments. Subscribe for evidence-based health content. Thank you for watching this video. Take care.